I can. We're ready? Able to communicate with you today. I apologize for the technical difficulties, but look forward over the next several minutes to talking with you and fielding questions from you about what is a really exciting development, namely the opportunity to vaccinate children 6 months and over with the COVID vaccine, one of two COVID vaccines, either the Pfizer vaccine or the Moderna vaccine. Last week, the FDA Advisory Committee recommended authorization of those vaccines, and in fact, the FDA followed immediately thereafter by authorizing the Pfizer and Moderna vaccines for 6 months and over. And what this means then is that the CDC's Advisory Committee on Immunization Practices, their external advisory group, met on Friday and Saturday, so 4 and 5 days ago, and heard all of the data and ended up recommending that either of those vaccines be used in children 6 months through 4 years of age with Pfizer or 6 months through 5 years of age with Moderna. And that opens up almost 20 million children in the United States to being in a group that now is recommended to receive the vaccines. And it essentially now covers the entire age spectrum. 6 months of age through a 90-year-old or a 100-year-old person can now be eligible to receive a safe and effective vaccine, the mRNA vaccines of Pfizer or Moderna. So it's a very important day and one where we can come back together again and talk through our vaccination program, answer some questions about any kind of uncertainties that may be out there, and hopefully get word out to parents that parents of young children now can effectively help their children not become very sick from COVID. And that's a good thing. So with that, I'm going to turn it to Hannah. I'm happy to take any questions. I believe that I hear the questions in my ear. I'll repeat them, paraphrasing them, and then I will give an answer. But I believe we can be responsive to you in the media who are joining through this Facebook Live interface. The question is about side effects for the population that was most recently recommended to receive. So side effects in 6-month-olds through 5-year-olds, essentially. And really, it was very similar to what was seen with either of these vaccines in older children, young adults, and older adults. Fever, maybe a little bit more fever with Moderna than with Pfizer, although these were not head-to-head kinds of comparisons. Body aches, a little bit harder to judge in a 1-year-old or a 2-year-old, but that was part of it as well. Some swelling of the lymph nodes, either under the armpit if the vaccine was given in the arm, but in these younger children it was more likely to be given in the thigh, and so the swelling was more in the groin area from some of the lymph nodes, which is exactly what you would want. That's the way vaccines, or for that matter, the actual infection works. The immune system comes in to mount a response, and that leads to drainage to regional lymph nodes. So if the vaccine's being given in the leg, it makes sense that that lymph node that would be getting larger would be in the groin area, whereas if it's given in the arm, it would be under the armpit. So really very similar safety profiles with what was already seen and what we're so familiar with now that we've had these vaccines for a year and a half in our other parts of our populations. The question is, if a child does have a fever after receiving one of the COVID vaccines, is it okay to give Tylenol or Advil? And the answer is absolutely. If your child does run some fever after receiving either of these vaccines, it is not only safe to give Tylenol or to give Advil, but really it could be the right thing to do because it'll make them more comfortable. And so there is no problem at all giving an antipyretic like Tylenol or Motrin, Advil, if a child does have some fever after receiving either of these vaccines. question is about the age groups for the Pfizer vaccine and the Moderna vaccine, and there are some subtle differences here. Pfizer had already been authorized or approved by the Food and Drug Administration for 5 years of age and older. So everything from 5 years up, all the way to the, oldest people in the country, had already received either authorization from FDA to receive the Pfizer vaccine or a full approval from the FDA of the vaccine in those older populations. So for Pfizer, the window that needed to be addressed was 6 months of age through 4 years of age, up to the 5th birthday, in other words. And that's what was authorized last week and what is now recommended by the CDC for the Pfizer vaccine. That's the gap that was closed this past, over these past 6 or 7 days. For Moderna, it's a little different. Moderna was initially authorized and then approved for 18 years of age and older. Last week, the Food and Drug Administration authorized the Moderna vaccine for 6 months of age through 17 years of age. CDC on Saturday, Friday and Saturday, the advisory committee to CDC looked at the data that related to the Moderna vaccine for 6 months of age through 5 years of age. And not 4 years like Pfizer, but 5 years for Moderna. And that's what is now recommended for the Moderna vaccine. And if you're listening to that whole explanation, you realize that the 6-year-old through 17-year-old is a gap right now where there is authorization from the Food and Drug Administration, but we do not yet have a recommendation for use of the Moderna vaccine in 6 years through 17 years of age. That will be addressed either tomorrow or the next day with another meeting of the external advisors to the CDC when they look at the Moderna data for 6 years of age through 17 years of age to determine whether a recommendation for use should also be given in that population. So I think it will be addressed very shortly. But right now, with what just came out, the breaking news, if you will, is that Pfizer, it's 6 months through 4 years of age. Moderna, it's 6 months through 5 years of age. Question is about the dosage and is it different for the youngest children versus the older child, adolescent, and adult? And the answer is yes. The Pfizer vaccine started for the adult and older adolescent, or I guess adolescent in general, all the way through, is 30 micrograms of the mRNA product in the vaccine. So 30 micrograms of mRNA per dose. That's for Pfizer 12 and over. For Pfizer 5 through 11 years of age, it's 1/3 of that dose, so 10 micrograms. For now, the recommended 6 month through 4 years of age with Pfizer, it's 1/10 of the dose of an adolescent or an adult, so it's 3 micrograms per dose. Moderna's different. Moderna started with 100 micrograms of mRNA, and they have had a sequential decrease in the amount of mRNA for the younger age groups as well. So their overall decrease was not as substantial proportionally as it was with Pfizer, and they started with a higher amount of mRNA. That may be why we saw a little bit more fever, for instance, in the Moderna group than the Pfizer group. It also means, though, that the Moderna group has, for the recommendation for 6 months through 5 years of age, only 2 doses of the vaccine required to be a primary series of the vaccine, whereas Pfizer, that's for Moderna, whereas Pfizer requires 3 doses to be considered a full primary series for their 6 month through 4 years of age. So the important thing is that, and parents know this, young children are not little adults. They are different, and therefore they require a different amount of the vaccine, and your pediatrician or your family practice doctor will have all the information needed to know which, based upon age, dose of either the Pfizer vaccine or the Moderna vaccine is appropriate for your child. Question is about if someone who's eligible to receive a COVID vaccine, and I guess the question really is about a 6-month and older, but I would apply this to anyone across the age spectrum from 6 months up. When is it safe, if they've had COVID previously, to receive a COVID vaccine, or for the older child and adult, a booster for the Pfizer vaccine? And the answer is as soon as they're over the COVID illness. Back in the early days, a year plus ago, we recommended that there be a spacing between recovery from COVID and receiving the vaccine. And the reason for that is we didn't have enough vaccine. So we had to take a limited supply and make maximal use of it. So presumably, and I think the data have borne this out, if someone has recovered from COVID, for a period of time, they have immunity. They have protection against getting reinfected. I'm going to come back to that in a second. And so in the old days of limited vaccine dosages or availability, we wanted to get the vaccine into the most vulnerable group, and that would be the group that had not had COVID before. We're not in that situation anymore. We have an abundance of vaccine, including the lower dosages of the vaccine for these younger age groups. And so now we can say that, and we know it's safe because the studies have shown this, as soon as you're over COVID, you can go be vaccinated. I don't know that you have to necessarily, rush in that very day that you come off of isolation. You certainly can. But over the next, month or two, it would be good to go ahead and make the appointment so that your child can be fully protected. And full protection is better conferred by the vaccine-induced immunity than it is by infection-induced immunity. And interestingly, the strongest protection does seem to be if you've had the infection previously and then get fully vaccinated. That's even better still. I'm not advocating going out and getting infected before you get your vaccine. I am saying, though, that if you have been, like 75% of all children in the United States, infected with COVID, especially during this last Omicron wave in January and into February of this year, if you then go get vaccinated, as is now recommended for 6 months of age and over, you will have maximally protected your child and done everything you can to keep them safe. Question is about whether children should be vaccinated before in the fall going back to school or going to daycare, and when that vaccination series may get underway. The American Academy of Pediatrics and other organizations that focus on the health of children have all recommended that children now 6 months of age and over be vaccinated against COVID. That is the best way to protect a child from the potential really bad effects of COVID, which I'll come back to, and they're not inconsequential. The timing of doing it would be now. Why wait? Especially when you consider that the interval between dose 1 and dose 2 can be either 21 to 28 days, depending on which of the two vaccines is being used, or out to 8 weeks. And there's some situations where having that interval between dose 1 and dose 2 going out to 8 weeks, we believe anyway, generates a stronger immune response, is a better take for the vaccine. So if you think about that, 8 weeks from now, is going to be August, and that's about the time people go back to school. Doesn't mean you have to wait the full 8 weeks. You can make it 3 or 4 weeks, but why not get everything underway, especially when it's sometimes a little challenging to take off work and get your child to the pediatrician's office or family practice office or whatever it may be to receive the vaccine. Don't put it off. There's simply just no reason to put it off. There's nothing beneficial about doing it that way. Now, I mentioned before about the negative impacts that COVID can have on children. And I think there's a misperception on the part of the public about this. It is true that a young child is less likely than an old person, 80 years of age, for example, to have a bad outcome from COVID. That is true. But 200 people, 200 children, 200 small caskets have been put into the ground after dying from COVID in these very youngest of children. COVID is either the fourth or the fifth most common cause of death for children and adolescents 6 months of age and over in the United States. The fourth most common cause of death or the fifth most common cause of death, depending on what age group of the 6-month through 17-year-olds that we're talking about. That's not inconsequential. And then among people who survive, and most children will survive, thank God, most children will survive from COVID. But of those that survive, maybe up to 8 or 10% will have long COVID. They'll have the long-term problems of breathing or problems with their heart or problems with their energy or whatever it may be that adults also can get, probably a little bit more common in adults than in children. But it can happen in children. So why run that risk? Why not do something to prevent that in the first place? And now we're fortunate to have these safe and effective vaccines for 6 months of age and over to accomplish exactly that goal. Question is about whether there should be an interval between giving or receiving, I guess, a COVID vaccine in a young child and when they should get their other childhood vaccines. The CDC is developing guidance on this, and the recommendation, as I understand it, will be that there does not need to be an interval between receiving COVID vaccine and receiving other vaccines. They can be done simultaneously. Now, it'd be ideal to give them in different parts of the body. So, for instance, COVID vaccine in one leg and the other vaccines in another leg. Or if it's in the same extremity, to have the needle. This isn't something parents need to worry about. Their doctor and nurses will know how to do this. But to make sure that the spacing between the two injections is at least an inch or more if it's in the same extremity. But that guidance, those recommendations will be forthcoming from the CDC like any day now, now that the authorization and recommendation has been made for children 6 months of age and over to receive a safe and effective COVID vaccine. And your pediatrician or your family practice and her office will know how to do that. Question is about how long-lasting the protection will be following immunization, and what is the degree of protection against some of the emerging, what we're calling now subvariants of the Omicron strain, which continues to be the predominant strain in the United States and indeed around the world. And the answer is at least several months for the duration of protection. And yes, full immunization, or if you're eligible for a booster, full immunization plus 1 or 2 boosters, depending on your age, will protect against Omicron. Now, and in the subvariants of Omicron, for at least several months after the immunization series or the booster is administered. Now, we've said from the beginning with these vaccines that this is a race against getting people immunized or immune to the virus on the one hand, and what the virus is doing on the other hand to try to outwit our ability to do that. And what we've learned really since Delta at the end of last summer, and then Omicron certainly over the wintertime, and now the subvariants of Omicron since that period, like in March and April and May with the subvariants, what we've recognized is that this virus is very good at changing, at adapting, at morphing into something new. Where Omicron seems to do, and the subvariants of Omicron seem to do better than the earlier forms of the virus, better for the virus, not better for us, is to evade or avoid our immune response, at least to some extent. And so that's why what would have worked well against the Alpha or the Beta variant or even the Delta variant is more challenging against the Omicron variant. That said, the vaccines that we have do with after a full series, or if you're eligible for a booster, a full series plus a booster, that will confer the kind of high degrees of protection against severe disease, hospitalization, and deaths. And that's what we need. And in fact, that's what we've seen, where we've seen with these subvariants, we've seen cases go up again. If you go to the CDC map, more of the United States is now yellow and red, and less is green. Green being good, yellow being moderate, red being bad. We're seeing more virus out there, but we're not seeing a concomitant increase in the overall deaths. We still have 200 or 300 people in the United States dying every single day of COVID. That's 200 or 300 too many. That said, it's not 2,000 or 3,000. And earlier in the pandemic, when cases went up, deaths, hospitalizations and deaths tracked a few weeks later going up like that. Right now, they're kind of holding low, and hopefully that'll continue to be the case. The best way to make sure it is to get vaccinated. And that's even if you've had COVID in the past. That's the best way to protect yourself. Question is about, when I talk about getting the population vaccinated, what am I really meaning? And I'm going to interpret the question a certain way. I don't know if this is how it was intended. Please type in a follow-up if I'm not addressing where you're coming from with it. You will recall early in the pandemic, I'm talking, in 2020, when everything was up in New York and CNN was breaking every day, and you heard the ambulances coming by. Even in Birmingham, you heard the ambulances constantly coming by and into the hospitals with sick people. Back then, we had an idea that if we could most rapidly get the population to 75 or 80% immunity with a vaccine, that we could establish what's called herd immunity. Herd like a herd of sheep or goats or whatever, or sometimes called population immunity or community immunity. That's not panned out. The virus has shifted from under our feet and became initially the Alpha variant, and then the Beta variant, and then the Delta variant, now the Omicron variant. And it's made it such that it is out there, and it will continue to be out there for the remainder of our lives and probably the remainder of our children, grandchildren, and great-grandchildren's lives. This is like influenza now, in that it will always be circulating somewhere in the world. So this idea of complete containment and elimination, that's gone. That window of opportunity slipped beyond our grasp in 2020 probably, or maybe early 2021. So what we need to do now is what we do with influenza, and that is protect ourselves before flu season by getting a flu shot, protect ourselves before COVID season by getting a COVID shot. Now, the difficulty right now with COVID is it's not fully settled into a seasonal pattern yet. I think it's getting there. But it's not like we can say that, I'm going to make this up, September, October, November is when you're most at risk of getting COVID. We're not there yet. So that's why it's so important that we get fully immunized and, if eligible, boosted, or if you're 50 and over, get a second booster in order to be ready if and when you're exposed, or really honestly, when you're exposed to COVID. Over time, I think it will settle into a pattern where it'll be really one time of the year is when we're supposed to get our annual COVID shot. But we're not quite there yet. And in the meantime, as we watch for that seasonality to settle in, protect yourself now, protect your children 6 months of age and over. Question is about boosters and the age for giving boosters. If your child is, or adolescent, or you, are eligible to receive a booster, and older children and adolescents and adults are, then they should receive a booster. And if you are 50 and over, then I guess anybody can be authorized to receive a second booster, 18 and over. But it's recommended for 50 years of age and over to get 2 boosters and not just 1. So that's why, I guess, to get to the booster, you got to have the primary series, and that's where I really want, especially parents of young children, to focus right now. But I do think, as we've gotten, I mean, all of us now are used to this, where there's change. You know, we think it's going to be one way and it's going to be locked in and this is what we're supposed to do. And then it's modified because we get better tools into more people. That's the vaccine. And the virus is constantly trying to slip out from under our grasp. And so we've got to be ready for these shifts in how we're supposed to do things. And that will, I predict, will include boosters for younger children eventually, not yet. We're going to get primary series first. But then also, hopefully, if we see that seasonality I mentioned a minute ago actually, kind of come into being, then maybe we get to more once-a-year COVID shots. That would be easy, and that's an easy thing to communicate as well. That's what I hope ultimately the pattern settles into. Question is about injections being scary for young children, and how can parents help prepare them for that? Well, one thing I would not do is talk a whole lot about it. I think that just makes everybody more anxious. So when you go, when you're going into your doctor for a regular child check, she or he will a lot of times already have other vaccines that are on that schedule for that particular visit, and you don't talk about that with your child when you go in. Use the cues from your pediatrician or your family practice doc on how to best have the child be as unanxious as possible. And of course, a very young child, like a 9 or 10-month-old, they're not going to understand anyway. So, these younger children that now are recommended to receive vaccines 6 months of age and over, they're going to, really not, they'll be pre-communicative in that regard. The other thing that you can talk with your pediatrician about is there can be numbing medicine, creams that can go onto the skin in areas where shots will be given. And some pediatricians or family practice offices will distribute that ahead of time so that the area of the skin can kind of be numbed up. Or they'll put it on while the patient is in the doctor's office and then go see another patient, come back a little bit later to administer the vaccines, and that as well can decrease some of the pain. If it's a younger baby, giving some sugar water through a pacifier, for example, can decrease the pain threshold. It's substantial. It's been proven in studies to happen in that regard. So there are ways that it can be done to make it not only less scary, but actually less uncomfortable for children. But I would not encourage, if you have a 2 or 3-year-old, I would not encourage you to say, hey, you're going to go to the doctor and get a shot. I think that all that'll do is make them very worried for a longer period of time, and it ramps up the degree of anxiety where it's sometimes hard to kind of get it back down. Question is about parents who continue to have some reluctance about having their child vaccinated against COVID. And truthfully, of course, now that may be the 6-month through 4-year-old or 5-year-old because that's this new group for whom the vaccine's available and recommended for use. But it really includes the 5 and over that have been previously recommended to receive the vaccine. We only have, 30 or 40% of children vaccinated that are 5 and over in our region of the country. And so we have work to do. And we need to do better with communicating to families why this is so important. First and foremost, my recommendation is to talk to your pediatrician or your family practice doctor. Talk to the doctor who you trust, who's taken care of your child from day one. and ask her or him, what do you think? What would you recommend? And what you're going to find is they're going to recommend that your child be vaccinated against COVID, because COVID is the 4th or the 5th most common cause of death in this age group. And if you can avoid that, you want to, obviously. In addition, when children get COVID, most of them get over it, thank goodness. But of those that get over it, 8 or 10% maybe will have long COVID. They'll have ongoing problems even months after getting over the COVID infection. That's a problem. And what we know more than ever through this pandemic is that children need to be around each other. They need to have play dates. They need to be in school. They need to be in daycare settings where they're learning and being stimulated and working and developing those social skills and all the important other things that go with being a young child. And the way to do that, the way to keep them there, the way to get them there in the first place is to protect them against the infections that they will be exposed to. And now that, most definitely includes COVID. Now, it also includes other things that are vaccine preventable. And so not only should young children and older children and adolescents be vaccinated against COVID, but they should also be vaccinated against the other regular childhood and adolescent vaccine preventable diseases. So it's important that we do all of these things to protect the health of our children and to protect the development and well-being of our children. And that in turn helps the parents, because then the parent doesn't have to take time off if their child gets COVID and stay home for 5 days to 10 days, depending on, on the duration of masking and whether they can go back to the setting where the child was before that. It helps everybody. So my recommendation, unequivocal recommendation, is please, if you're eligible to receive a vaccine, or for older children, adolescents, adults, to get a booster after you've been fully vaccinated and you've not yet had all of your eligible doses, please contact your doctor, talk with her about it, see what she says, and then when she recommends it, follow through because you trust her. And hopefully you trust, those of us in the broader medical field, people like me, trying to get the word out about how important this is and why this is such a period of celebration for us. Now that we can do something for 6 months of age and over, we're there. We're in the red zone. We're close to the goal line. But to get the ball over the goal line now is more than ever a team effort. It's not just up to one person or a small group of people. It's going to appropriately require parents to step in and say, we want this. And that's what I'm asking parents to do. Well, thank you for being with us these last several minutes. Apologize again for the inconvenience of the technical difficulties. The only thing I can think that we've not touched on so far are potential new vaccines. And I think it's important to realize, it's nothing actionable right now, but the companies that have made our very safe and effective mRNA COVID vaccines so far are already working on Omicron-based vaccines that may be used as boosters in the future. They are being studied now, either as Omicron by itself or Omicron plus an earlier version of the spike protein, the outer part of the virus that is what the immune system makes an immune response to. That's why the vaccines work. So they're looking for ways, as the virus continues to adjust, to have the vaccine continue to adjust as well to provide maximal protection. We're not there for that yet, but just be aware that no one's resting on their laurels right now and saying, hey, we've whipped this, because we haven't. This pandemic is much better than it was, but we're still in the pandemic, and it can come back at any point. And parents and regular people out in the world, we all need to do our part and get vaccinated and boosted if eligible for boosting. But the scientists also are doing their part, and they're continuing to adjust and modify and improve the vaccines to meet the current challenge of where we stand with this pandemic. So all working together, we can do this. And we've already shown how effective we can be when we work together. That's why the vaccine is done so well, and that's why the pandemic is less bad now than it was this past winter or than it was, coming out of last summer, because we're doing this together. So let's hang in there. Let's keep doing it. Thanks, everybody.